Good morning. Grab some coffee here. Good morning, everyone. Hi, it's Stacy. This is Walking in My Shoes, and we are loving my veteran this morning. Just wanted to say hi and grab some more coffee before we get started on a very interesting topic. As always, with Walking in My Shoes and Loving My Veteran, we are not paid professionals or counselors. And in this case, especially if you have a question, you need to seek professional help. Always follow the advice of your doctor. Um, it's just better that way. And all the information in this is copyrighted to Loving My Veteran. So it's going to be a little difficult for me this morning. You're going to see me kind of turn my head and go back and forth between screens because I'm working off of the PowerPoint slide too. So today, actually all week, morning, Pam and Elisa, we're going to talk about TBI and PTSD. We're going to talk about the facts, understanding how the brain functions, um, treatments, physical changes that happen to them, changes in the brain, mental changes that happen, the causes, the symptoms, the diagnoses, and of course, treatment options. So, those are just some of the things we're going to cover. It'll be an intense 5 days, and we'll ask this question a couple times throughout this whether or not we think we need to do a Zoom seminar on this to get a little more detail and feedback. So, let me just talk about this. You know, when we talk about these things, PTSD, let's just talk about that first because we're going to talk about them separately and together. PTSD is a mental health problem that some people develop after experiencing or witnessing a life-threatening event like combat, natural disaster, car accident, or sexual assault. That's what they call it today, is a mental health thing. And we're going to work on changing that because I think that's ridiculous. It's normal to have upsetting memories, feelings, feeling on edge, trouble sleeping after a traumatic event. It may be hard to do normal activities like go to school, spend time with people. They typically start to feel better in a few months, not necessarily with combat PTSD or with any PTSD. It's just not, that moment is not as tragic. Um, if you're still having symptoms after 3 months, it becomes PTSD. They may start later, they may come and go over time. So just be aware of that. And that is defined by the VA. So I wanted just to tell you that as well, that that's how they define PTSD. Now I'm going to make sure I get on the right screen because I'm trying to learn to use a double screen, and this is like way interesting and out of my league here. Sorry. A TBI. A TBI may happen from a blow or a jolt to the head or an object penetrating the brain. When the brain is injured, the person can experience a change in consciousness that can range from becoming disoriented and confused to slipping into a coma. The person may also have loss of memory for the time immediately before or after the event that caused the injury. Not all injuries to the head result in a TBI. Again, that is defined by the VA. Do those technical definitions help? Not really. I think it just makes us confused as we were before. So I don't think that that's necessarily helpful in those technical terms as defined by anybody. So we're going to talk more about the physical stuff and get to where it kind of makes sense for all of us because we don't need the technical. Society's definition. When you think about what society thinks about PTSD and TBIs, they give you this impression that people are crazy, that they have multiple personalities going on. Just because you're a veteran does not mean that you're crazy. We tend to think of them as sitting around drinking, smoking, and not being functional. Homelessness a lot of times comes with that TBI, PTSD diagnosis. We think of that, society does. They think of cheerfulness happening a lot, or they think of, as I call it, the John Rambo scene, and that is very true in that. Currently, 22 veterans a day take their own lives. Having PTSD and TBI greatly increases that risk. So, according to the CDC, TBI, this is horrific. TBI suicides, TBI suicide deaths surpasses MVC, motor vehicle collisions, as the leading cause of TBI related deaths. So if you have a TBI, your odds of committing suicide are higher than dying from the traumatic brain injury in a car accident. That is just overwhelmingly staggering to me. Rutgers Health states that people with TBI are twice as likely to die by suicide than those without a TBI. A 2014 report shows that 20 in 100,000 people without a TBI commit suicide, as compared to 41 in 100,000 people with a TBI. A Danish study in 2018 confirms this. It was published in the August 14th, 2018 Journal of American Medical Association. According to the VA study, male veterans with PTSD were 1.8 times more likely to commit suicide than those without PTSD. And a report by Matthew Tull, he's a PhD, this was updated 3/22/20, stated that people with a diagnosis of PTSD at some point in their lifetime, approximately 27% have also attempted suicide. Another large-scale survey found that 24% of military personnel diagnosed with PTSD had experienced suicidal thinking within the past year. I find those numbers staggering. So I did a little more. In the last 13 years, the military, the VA, estimates there have been 500,000 former military veterans who have been diagnosed with PTSD or TBI. That would mean that 20,000 of them a year either attempt or are successful in suicide. 20,000 a year either attempt or are successful at suicide. We all have heard the 22 a day. The concept is to get from 22 to none. And if we don't stop looking at PTSD and TBI as a mental illness and continue to throw medicine at them, and we need to start treating them as a physical injury, we will never reduce those numbers. They are a physical injury to the brain. So you have to understand that it is a physical injury to the brain. I'm working off of a PowerPoint that I'm putting together, and I will eventually post the PowerPoint so you can see the slides better. But let's look at the brain. So each area of the brain has a specific job. And when there's damage to that area of the brain, either due to PTSD or a TBI, it doesn't work right. Okay? So that goes on. So your prefrontal cortex, which is up here in your head, it's your thinking, your logic comes from that area, what to do, and evaluations, where your brain says, hey, is everything okay? That happens in your prefrontal cortex. Okay? Your hippocamus, which is kind of in the center in here, it regulates memory and emotion. Right? That's what it does. And you're going to hear me talk about the amygdala. Those are two little almond-shaped things in your brain. They're deep in the center of your brain, and they're there specifically to protect them. They turn on that flight or fight, and they store memories of the event. So what happens is that amygdala gets overstimulated, and some of the treatments that we'll discuss further on in this series talk about reprogramming that amygdala so that the memory will stay there, but the outcome of the memory will be different in the way the amygdala responds, and they're finding success in that treatment in 90% of the patients. 90%. Stephanie, I'm going to spit this out in the middle of this just while I'm thinking about it. I am reaching out to Emory and to Shepherds today to see if we can get a meeting to go visit them. If you would like to go, or you and Mike would like to go, just putting it out there, because I think what Emory and Shepherds are doing is amazing. All right, so where the injury occurs in the brain determines the symptoms, okay, of the TBI. So you've got this brain sitting here, this very large brain sitting here, and this frontal lobe up here, which comes from about here all the way down to here and back. It creates lack of focus, irritability, and language difficulty. So a lot of times your veteran can't find the right words. They become more irritated. They become not focused, and you'll get that whole squirrel thing. They'll be in the middle of a conversation and they'll get up and they'll walk off. That is damage to that frontal lobe. Okay, that's what happens there. The temporal lobe kind of sits back behind it, right at your temples. That's why it's called a temporal lobe. Those create problems with short and long-term memory. So when there's damage to that area of the brain, they don't remember things correctly. I know that, Sarah, we're talking about your veteran. I know that he has a TBI. There is damage in that temporal lobe that keeps him from those short and long-term memory problems. The parietal region is just back in here. It's just about halfway back and comes in there. That has to do with reading and spatial misconceptions. That's what goes on there. Your occipital lobe is back here in the back. That deals with blind spots and blurred vision. Your cerebellum is kind of just at the right above your brainstem. That deals with difficulty in walking and slurred speech. And your brainstem itself has changes in breathing and difficulty swallowing. So you can see that where your injury to your brain is can have different effects. So we think, and the general consensus is, when you diagnose a TBI, you're going to have all of that. That's not true. It's where the injury lies in the brain that is creating that problem. Well, again, we go back to the fact that people say, oh, it's mental health. It's mental. It's psychological. Let me throw psych drugs at them. Let me do this. Let me do that with them. We are finding that that is not true. It is actually injuries in the brain. So when we talk about this a little further, let's take, for example, and I can speak on Shepherds because I have taken many patients to Shepherds and I have dealt with Shepherds. Shepherds is a spine and brain institute. That's what they do. They take people who've had traumatic injuries to the head and to the spinal column, okay? And once that area is damaged, it doesn't necessarily come back, but they can realign where that goes. So the neuropath, they can realign that and get something else to help do that. So we find that a lot, and they can do that through use of retraining your brain. So it happens, and they are very successful at what they do, but they treat brain and spine injuries as that. Instead of treating PTSD and TBI as mental illnesses and treating the whole thing, when you go to some place like Shepherds, they say, oh, you're having a problem with lack of focusing. That's in your frontal lobe. Let's map that and let's re-trigger a different place in your frontal lobe to address that. Okay, so that's what's happening. If you're having problems with short and long-term memory, they realize that's in your temporal lobe, back in here by your temples. So what do then? They reprogram that to help you work and do those things. And I've seen this happen on many patients many times, and it's very, very successful. So the concept of treatment is not, here, take this pill for your irritability. Okay, if you're irritable, let me take this pill for your irritability. if you still have damage to your frontal lobe, how well do you think the pill is working for the damage to your frontal lobe? You might be masking the symptoms or trying to slow them down, but you're not fixing the root of the problem. Okay, both a TBI and PTSD cause damage to the amygdala. That's that little, it is tiny, y'all. It is little like almond-shaped area deep in the brain. And that regulates your sympathetic and your parasympathetic nervous system, which I'll explain to you in simple words. But it is deep within the temporal lobe. Okay, that's where it sits. And I call them the little almond-shaped things because it took me forever to say amygdala. And what it does is it creates the autonomic responses associated with fear. Okay? So, you've been in a car wreck. Your fear level goes up. You got your kids in the car. You immediately are like, your heart rate starts to pound, right? You feel like this tightness coming in your chest. Your breathing gets faster. You make sure your kids are okay. You're panicked. We understand that. You have emotional response. You may cry. You may scream. You may do whatever. That is all controlled by the amygdala. It processes and consolidates your memory. So during a horrific car accident, the body is set up so you don't necessarily remember all that. There's a lot of times people are involved in accidents that they do not remember the accident. Well, they don't because the amygdala says it's too much for you to process right now. You can't remember it. And that's what that amygdala does. It also deals with hormonal secretions. We find a lot of times, and Boone talked about it in his book, FPL, that testosterone levels are low in people who suffer from PTSD and a TBI. It's not because they're not manly. It's because that part of the brain is injured, so therefore that part of the brain doesn't produce the testosterone that they need, okay? And it messes up their system. So when we're thinking about how the approaches, how the social approaches, how the approaches to our veteran, they get in this mindset they're defective because they've been told they're mental when in reality they're physical. If you went to your husband and said, not immediately, but in conversation after everybody learned that the amygdala is damaged from the TBI or the PTSD, and therefore is not producing the testosterone, and therefore it's creating these problems, right? Not just erection and not just sex, but it's creating these problems. It's going to be much more likely that he will go out and get tested and take the testosterone every day because now he realizes that there's an injury. He's not crazy at this point. There's an injury to his brain. So when we understand this, we go in at this point and make sure they understand what's going on. And it makes so much more sense as we go through this process with them. Okay, the amygdala in veterans with PTSD and a TBI is hyperactive. That means it works more. It's hyper. Think of your kids being hyper. That's what it does. All right? So it basically means that their response to fear or anxiety is increased and it takes longer to subside. So let's talk about triggers. When your veteran is triggered, think about this and tell me if these symptoms are not true. And you may not notice this first one, but their pupils will dilate. Okay? They will decrease their production of saliva and tears. Hence, they don't cry a lot. Their respiratory rate will go up. Their heart rate will increase. Their blood pressure goes up. When you look at the correlation between PTSD and increased blood pressure, Most of them go hand in hand, and the blood pressure does not respond to typical blood pressure medications, so they are on a ton of them to try to bring that blood pressure down. Your body releases a lot of glucose. It does that for muscles, and we'll talk about that in a minute. Your adrenaline kicks in, all right, and your digestion at that point slows. So that is an autonomic response. We don't control that. Right? We do not control that. The sympathetic nervous system in our great bodies that we have get us prepared for fight or flight. Either fight for our survival or run away and get out of there. And you need all of those things to be able to do that. You need the increased respiration so you get more oxygen. Okay? You need the increased heart rate so the oxygen gets to your brain and to your muscles like they're supposed to. You need the increase of the glucose because glucose is what fuels the body. You need the increase of adrenaline because if somebody told me I had to run a mile, I can't do it now, I used to be able to run all the time, but if they told me I had to run a mile, girl, I'd be laughing. But if I had to, because the car was going to explode or this was going to happen or something was coming, I could run that mile if I was in a fight or flight situation. Right? And you don't need your digestive system to work because it takes a lot of energy, because you think about how long your intestines are in your stomach and all that stuff. It takes a lot of energy from your body to get all that to work. So it doesn't, because you don't need it in that situation. Well, in most people, that lasts a very short period of time. And then your parasympathetic nervous system kicks in. And what that does is that gets your pupils to come back down to normal. They constrict. You get a lot of saliva and tears. And that's why, especially women, y'all, after a traumatic event or after a crisis or after we're done dealing with the important thing at hand, like a car wreck, and we know our babies are okay, even if it's a minor fender bender, we will cry because saliva and tears reproduce at that point. Your respiration rates will come down, your heart rate will come down, and your body will pick up all that excess glucose that it didn't need and start storing it. Your adrenaline will go down, and your digestive system will kick in. So a lot of times after we experience a crisis, we have to go potty, gotta poop, get the running stuff going on. But that's why, because that's how your body works. Now remember, there's an injury to their brain with PTSD and TBI that create that amygdala to keep the sympathetic nervous system lasting longer than the parasympathetic to kick in. All right, so when they see, let's just say they see something on TV that triggers them, that trigger can go on. It may not bother us, and we're looking like, what the hell, right? We do it. I mean, that's just it. But what happens, you can watch them. I can watch. His pupils get bigger. His respiratory rate changes. His heart rate changes. You can watch that happen if you know that it's going to happen, and that may be a sign of this impending trigger coming. And remember, their brain automatically does this. This is an automatic process. So when they are triggered and their amygdala is hyperactive, this is what goes on. And it takes longer for the parasympathetic to kick in. That's what happens in the reality. Okay, so physical changes, again, we'll talk about them real quick. There's technical terms for this. It's catecholamine hormones such as adrenaline and noradrenaline. They're released to facilitate that immediate physical reaction associated with preparation for violent muscular actions. And that's where you're going to have to fight or run. Okay, so if you're going to fight, you're getting all ready. And if you're going to run, you know, you got to use your calves and your thighs and all them lovely little muscles so it gets ready. You get that accelerated heart rate, okay? And you breathe faster. It just does that. Sometimes you'll see them turn pale or flushed, or they may flip back and forth. It constricts blood vessels to many parts of the body. like your stomach, your digestive system. It doesn't need it, so it constricts that, causing a rate in your blood pressure. It increases the use of glucose and fat stores that gets you ready to do that fighting. It gives you your energy. It dilates the muscles that are going, the vessels that are going to your muscles, all right? And it creates a lot of oxygen there so that it creates rage and super strength. How many times during a PTSD episode have we seen them get super raged or super strong or super whatever? It's the same thing that happens. We see it on the news every now and then. Oh, when we were talking about good news, that there's been a car wreck and the car's pinned somebody and four guys can pick up this car. That is part of the autonomic immune system kicking in. It gives them that superhuman strength. Okay? Their dilation of their pupils, it lets in more light and lets their scope of vision become wider, and so they can see more for their own protection for a potential threat. It inhibits erection because you don't need to be doing that when you're having this going on. So a lot of times we hear spouses say they can't get it out. Well, they may not be able to, because if they're living in this PTSD moment, it may not work, and the medications play a role. They get auditory exclusions. They lose that sense of hearing. They can tune into something very specific, but they can tune you out to the rest of the world going on around them. They can listen to exactly what they need to hear or what they're focused on, but they don't hear the rest of the world. Same thing happens with us when go back to the car wreck scenario. Right? Tunnel vision. They get very focused on what they're seeing and not what's going on around them, even in the tunnel vision aspect. Okay? You'll see them have shaking going on, and that is part of this symptom. So it all starts to play out, how it all comes together, because it's a physical injury to the brain. Now, when somebody would have told me that before, and I'm a paramedic, I kind of understand how this works, until I realized there was just damage to the amygdala, you just think he's acting, or she is acting like they ain't got any sense up in them, and how come they can't control it, and why can't you get it together, and why can't you do this, and why can't you do that? You can't, because you physically can't do it. You have damage to that body, and you physically can't do it. Utilize a person having a stroke and they have right-sided weakness, or they don't use their right side at all. You can't go in and tell them to lift their right hand to their mouth, because they physically cannot do it. Right? Because those neurons in the brain have been severed and they don't work to make their right side work. So you can't expect somebody who has damage in their brain from a stroke, right? You can't expect them to use their right side if their right side is paralyzed, and you can't go in and expect them to get everything under control when it comes to this stuff that's going on if their part of their brain is damaged. We can, however, work through this. And there are treatments. Some do require medication. The SSRIs do help. There are other treatments that are available, and we'll talk about them at length as we go through this, but we have to understand what's going on in the brain to make ourselves aware of, oh my gosh, this is what's going on. He's not crazy. I'm not crazy. We're not crazy. This is a physical injury. So that is kind of where we're going to wrap up today on this physical injury. There is so much more going to come about. And when we talk about things like a TBI, they don't have to be severe, people. They don't have to be that they have been in an IED explosion, or been in a wreck, or been in a helicopter crash. When they're shooting some of those weapons, there's concussions, there's percussion that comes out, and it concusses the brain. And I'm going to actually be able to put this up and show you tomorrow, but I'm going to use, of all people, Aaron Hernandez's brain. Okay? Aaron Hernandez, which we all know was the football player who ended up committing suicide, but whatever. He suffered multiple concussions, which are considered a mild TBI. When you look at the damage to his brain that was done on autopsy, which I'm sad that whatever he's not here, but the fact that we got to see the slices of his brain, and when you get to see that physical damage, you're gonna be like, oh crud. Actually, I said oh shit, but whatever. You're gonna see that, and you're gonna see that damage is there, and you're gonna see, wow, now I'm beginning to understand it. Now, I'm not telling you that this can't be worked on. I'm not telling you that we can't all work together to come up with a solution. What I'm telling you is, or what I'm hoping to do, is educate you on what goes on in the brain and how it works, so you understand what they're going through, the physical aspect in the brain. So now you can sit back and say, huh, it makes sense to me. Everything I just told you about the autoimmune system, autonomic system of the brain, when I told you that, all of a sudden it all makes sense in what happens in a trigger moment. Everything that's listed, we experience. Not because they're trying to be dicks, but because it's the way it works. So that's what happens. So I wanted to share that with you. I wanted you guys to be aware. This is, like I said, a 5-part series. I have had numerous people from other platforms ask me today and over the weekend, when they knew this was coming out, would I do a Zoom interactive where we could address these things and go back and forth. And if that's something y'all feel that we need to do, at a later date, where we could do, maybe break it up in 2 sessions, and you can physically have your veteran there and listen to what they want to as well, it will make sense, and especially when we get talking about some of the treatments that are available. But again, I think the number that was the most shocking to me was that of the 500,000, just based off of statistics, 20,000 veterans a year either are successful at suicide or attempt suicide. And we're never going to get from that 22 a day until we reevaluate where we are. So just wanted to say thank y'all for being a part of this. There will be a lot more. I will try to get the whole presentation up. It's through PowerPoint, or most of the presentation up through PowerPoint, where y'all can look at the slides and the pictures and really kind of understand what we're talking about, so that you see it firsthand, because they are staggering that information. So this has been Walking in My Shoes. There will be, like I said, at least 4 more parts of this, because it is very intense, to help us really understand what goes on in their brain. I hope y'all have a blessed day. I'm Stacy. This has been Walking in My Shoes, and we are loving my veteran. Have a wonderful day. Bye.